Here's my 2 note cards for my visual aid speech. So what if someone you witnessed collapsed? What if they were not breathing or they did not have a pulse? Would you know what to do? CPR can save a life and double a person's chance of survival by 2. Not everyone is in the hospital when they have a heart attack or cardiac arrest, so it's important for everybody to learn how to perform CPR. As a nurse, I have witnessed the miracles of someone surviving after receiving CPR. CPR is easy to learn, and it can be given as hands-only CPR or CPR with compressions and rescue breaths. So if 2 people are available, one can focus on compressions while the other focuses on breathing. So there's 2 types. There's the hands-only CPR, and pretty much you give compressions to keep the blood flowing to vital organs, but you do not give mouth-to-mouth. Some people do not like to give mouth-to-mouth to strangers, so this is a good option. It also is a good option for trauma because it does not move the head or the neck, so it's good if there's a suspected spinal cord injury. You can also give compressions with rescue breaths. During this, you're keeping the blood pumping to the organs, but you're also attempting to reoxygenate the blood. And then if you do give this, and you could use a face shield, which covers the mouth so that you can have a barrier between you and the individual. So for the steps to perform CPR, you first want to survey the scene. You want to make sure it's safe to help because we don't want 2 victims. You also want to tap and make sure that they are actually unresponsive. And then you want to check for breathing and check to see if they have a pulse. The best location to check to see if they have a pulse is the carotid artery. It's on either side of the neck, just below the jawline. This is a reliable option because it's easy to find, and it's also closer to the heart, so it's often stronger. So then you want to either call 911 on your cell phone, and you can even put it on speaker and begin CPR, or you can send somebody to go call 911. You don't want to leave the individual. So then you start compressions. For compressions, you want to make sure the person is flat on their back, and then you want to have proper hand placement. So for adults, you use 2 hands and you put one hand over the other. But for children, you can use 1 hand and use your palm, and for babies, you can use fingers. So for babies, you can use 2 or 3 fingers, and you can either press down straight down on the chest, like this picture, or you can use 2 thumbs and go around the infant and compress. This is currently the recommended way because it's less tiring using your 2 thumbs, and but it's still reliable. So then you want to make sure your hands are in the proper placement. So you want to place it at the sternum, at the nipple line, and then you want to keep your arms straight while you compress. So then you compress at a rate of 100 compressions per minute. And then if you're doing hands-only CPR, you continue this until help arrives or until the person is showing signs of life again. So then you can do rescue breaths with the compressions. For this, to give the rescue breaths, you want to tilt the head back, using your hand under the chin and then placing your hand also on their forehead. And then this just further opens the airway. You would pinch the nose and then breathe in by covering their mouth with your mouth, and then you give the rescue breaths. When doing this, you give 2 breaths after every 30 compressions. And then if an AED is available, you can use that. This is available in most public places, and it uses electricity, and it also senses what the heart rhythm is. So you want to start CPR before either retrieving the AED or attaching it. This reduces the amount of time that the body goes without blood circulation. So the AEDs are very user-friendly. You attach the pads by first exposing the chest, and then the pads show you where to place them. So you place one in the upper right, and then one on the lower left, like on the rib cage below the breast. So the AED will prompt you as far as what to do. It will tell you when to stop compressions and when it is analyzing. When it's analyzing, it is looking at what the heart rhythm is. It'll then tell you to continue compressions, or it will tell you that a shock is advised. If a shock is advised, you want to make sure no one is touching the individual. And then on the AED, there is a red lightning bolt button, and you would press that to deliver the shock. So it will then have you restart compressions, and every 2 minutes it analyzes the heart rhythm. So in conclusion, CPR saves many lives every year. You want to begin CPR early in order to double the individual's chance of survival. Since you never know when or who may need CPR, it's important for everybody to learn. You want to learn the different options and figure out which option you're most comfortable with. You always want to keep in mind your safety. Check your local Red Cross or hospital for available classes. And then you can check out Mayo Clinic, Red Cross, National Institute for Health, and then also websites such as harmreduction.org, heart.org, and arizonaheart.org for more information.